But at this point, that's all I can offer.
It's not that I don't have confidence in your guys' abilities. I just didn't agree with the treatment that you're asking for me to do to myself. And I never yelled at anyone.
Okay. Well, we felt like you were yelling. You were definitely, I definitely think you were yelling at us. Like, that's why I went in and intervened.
Okay, like as you annotated at the beginning of this conversation here, when you said you thought I was going to record you, first, you're allowed to record people in Ontario with only single party consent. Second, the recording clearly indicates I was not yelling. So like you can make these statements that I was yelling, and then you can use that as a substantiation to get rid of me as your patient. But the irrefutable evidence indicates that I was not yelling at you. And if I was upset, I was justifiably upset, but I was certainly not threatening, and I was not yelling. And when your nurse lied to me in person, in front of the student you had there, and then I said, "Can you please let me finish?" And she continued to cut me off, at which point I said, "No, this is not what happened." And I recounted to her what had happened, how she had turned me away for treatment despite following her requests. And then she didn't deny what I said. So there seems to be this disconnect between where I say one thing and you guys say one thing, and I have no evidence to support it until I recorded it. And now you guys are still turning around and saying that I was yelling at you and that I was not, and I was acting in a hostile manner. If you can go listen to that recording there, and it's very obvious I was not yelling. Very obvious. It was barely audible to the point where I was talking so calmly. And so the issue I have is not your guys' competencies. I think you guys are capable doctors and nurses. It's this unwillingness to actually follow through with things that you're obligated to do, and then accusations of shortcomings on my part. That is the issue. And so I'm willing to continue with a working relationship with you, but there needs to be a reasonable approach to the patient-doctor relationship here. And I'm not getting that from your side.
I'm just going to absolutely quote you on your medical review. It's right in front of me right now. It says, quote, "I've never received worse medical treatment," end quote. So clearly there's been a breakdown. Like, if you've never received the worst medical treatment, you're not happy with us. And the other thing too, Matt, you can't come in and threaten to say you're going to report us to the college. That right there is grounds for dismissal, because that tells me that...
No, it's not. Dr. Alistair, I'm literally saying to you right now, the treatment for that condition, I've never received worse treatment. You're capable of rectifying the situation by altering your behavior. If you're going to do something that is considered to be malpractice or not up to speed with the College of Physicians and Surgeons of Ontario, it is my obligation to report you. It is not a threat. If you are doing something wrong and you refuse to change your behavior, and I pay into OHIP, it is my obligation to report you because you're not conducting yourself in a fashion that is good. I think you're capable of changing your behavior, and I'm happy to continue seeing you as a patient. But it's not a threat. A threat carries a legal definition of violence or coercion behind it. There was no threat of violence or coercion. I said I would like your behavior to be up to speed with what you're obligated to, and you didn't want to change your behavior. So I said, unfortunately, I'm going to have to report you because you're asking me to do something that is both unsafe and uncalled for.
What is unsafe about my behavior? I'm just curious.
Well, they're trying to get me to cut my own foot with a scalpel. And you maintain that you said use a pumice stone. But earlier in conversation with your nurse, she was like, no, you have to use the scalpel. She said, what were you doing up to this point? And I said, I was using the scalpel as per your request, but I don't feel comfortable doing that anymore. And she said, well, you have to do that. And then you came in and said, I never said that. I said, use the pumice stone. So there's this disconnect between what your practice, maybe you're not saying it, but your nurse certainly thinks that's what you're saying. And that's what I think what you were saying. And so the two of us, your nurse and me, are both saying, yeah, you're supposed to be using a scalpel. And then you're turning around and you say, I never said to use a scalpel. Well, then why does your nurse think that I'm supposed to be using a scalpel? And so there's this disconnect here.
Yeah, I just think, Matthew, you've had a run-in before with that nurse as well, and I gave you, I just don't. This is definitely not going anywhere, and I know you're going to report me to the college, so I think you should just go ahead with that report because I don't think this issue is rectifiable between us, especially when you're leaving, 1-star reviews and just really trashing our team. It's hurtful, whether you feel that's true or not. It just clearly shows that there's a breakdown in the patient-physician relationship. So I don't feel comfortable treating you at this time, and
So will you send me another letter saying that the reason why you're dismissing me is on valid grounds then? Because I did not say I no longer wanted to be your patient. That's not what I said. And on top of that, I would like you to recount the events as you recall them, of how apparently I had a breakdown with the nurse. Because from what I remember, she told me to cut deeper into my foot with a scalpel. I told her, if I do that, it will result in me bleeding. Will you still treat me the next time I come in? She said, yes. I cut deeper. I went in for the next appointment. She said I'd cut too deep.
I'm not going to discuss this anymore because we're not going to get anywhere, okay? So I think we should just leave it at that.
Well, but Dr. MacDonald, you're using this as a substantiation for terminating my status with you as a patient. And when I'm trying to figure out what happened, your nurse says one thing, you say another thing, I say another thing. And so there doesn't seem to be really a foundation for terminating the relationship.
I think absolutely there is, and I've already expressed to you why that is, and I will be sending out another letter. So you can take that to the college if you wish.
It says in the termination policy that a breakdown in disagreements is not grounds for. It says if it's irreparable for reasons, and they list the reasons, then you can terminate me as a patient. But if you're just going to terminate me because you don't like me, I don't see that as a just cause for getting rid of me.
Yeah, that has nothing to do with it. So, anyways, fortunate that it had to end this way, and that I think I wish you all the best in the future. Okay.
Okay. It's unfortunate. Hopefully my wife still receives fair treatment from your wife who works at the clinic as well, and that this doesn't impact their relationship.
Okay. Thank you.